Okay, we're going to go through our PNF stretching techniques, our proprioceptive neuromuscular facilitation stretches. Now remember, we've got two types. We've got our contract relax, where we're contracting the muscle we're targeting to lengthen, followed by a sequence of relaxing it. And then we've got our CRAC stretches, which is contract, relax our target muscle, then antagonist, contract the opposing muscle for our reciprocal inhibition. We're going to start down with the ankles. Now remember, we've got to do a straight leg and a bent leg variation. Sort of an anchor, but not put pressure down on locking the knee. Now I'm going to sort of cusp the heel with my hand and use my forearm to pull back into dorsiflex, so I can get all the toes, all the digits, and the foot, the first ray and beyond. And I ask my client, after about a 10 to 30 second static stretch, I'm going to ask my client to plantar flex into my calf. Go. Now I'm just fighting back. So she's contracting, but the range of motion or the joint angle doesn't change. After about 5 or 10 seconds, I'm going to ask my client to relax. I'm going to maintain the pressure I was fighting her with, no more, into a further stretch. I'm going to hold that static stretch passively for 5 to 10 seconds, and then we're going to repeat. Contract, that's it. 5 to 10 seconds passes, and then I ask him to relax, followed by a further stretch, if available, for 5 to 10 seconds. I'm going to repeat that cycle for 4 to 5 times. Okay. I'm going to go to the bent leg variation. Here, it's very much the same. I've just got to cusp the leg so it's nice and passive and relaxed. Here, I'm going to demonstrate the CRAC variation. So same position with my foot, my hand on her foot. I'm going to pull back into dorsiflex, ask my client to push into my forearm, that's it. 5-10 seconds, then relax. I increase the range of motion a few degrees, and then I'm going to ask my client to try their very best to lift their toes off my forearm. So the tibialis anterior will be contracting, which will then reciprocal inhibition the soleus in this case. And then relax, and I push further into a stretch passively, 5 or 10 seconds. After that passive 5 or 10 seconds, I'm going to ask my client to contract and dorsiflex again. So we contract our target muscle. Relax after 5 or 10, and then followed by the antagonist, tib ant, to contract, and I let that go. Let that happen. After 5 to 10 seconds, I grab, tell my client to relax, and go further into a stretch. Okay, so you can choose either one of those variations for the straight leg or the bent leg variation for the ankles. Next up for our PNF stretches, we're going to do the hamstring. Here we are going to a bent knee and straight knee variation. Now yes, the straight knee will get a bit of glute, but the glute's not at its end range. So it'll mainly still be targeting the hamstring in this case. So if I start with that straight leg, now what you might do is, because it's quite a strong muscle, you want to anchor yourself in quite a strong position. I put the heel on my shoulder or my chest like so. Okay, now I've got to be mindful I don't push so far into a stretch that it's going to lift the opposing leg, the contralateral leg. Okay, I'm just going to go till about an 80-90% stretch of my client. I'm going to hold here so the knee doesn't bend anything further, and I ask my client to straight leg push down into the ground. That's it. 5 or 10 seconds, and we relax. I maintain that pressure and just give some range of motion if available. Then again, contract into me, that's it. This is the CR, the contract relax variation. Relax. And I just go further into range if needed. And now I'm going to straight into the crack stretch, the CRAC, where we contract, this case, the quads and the rec fem. So after a contraction of the hamstring, and a passive relaxation stretch, I'm going to ask my client to have her best attempt at lifting straight leg off my body. Exactly like so. Hold that for 5 or 10 seconds, and then I'm going to meet the client there at that stretch. I'm going to follow into a contract stretch, so push into me. 5 or 10 seconds, relax. Give some range of motion if available. Antagonist contract, so pull off me, that's it. 5 or 10 seconds passes, I grab the knee and just meet them there. Okay, so 5 or 10 rounds of either one of those will do. For our bent knee, okay, we're in this position. Now we're in 90 degrees or just beyond 90 degrees hip flex. And the cue here is heels to hip, so we're going down like this way, okay? Rather than the hip extenders, we're now going to go the knee flexors, okay? So in this case, I'm going to hook over like so. So I'm in a nice strong position, okay? I'm going to hold the knee in that position so the hip flexors don't try to take over. And I ask my client to try to pull her heel to a hip. That's it. And relax. Lengthen out. Again, push down. And relax. Okay, we should be feeling a stretch here. So now our third one, going to pull heel to hip, pull down. That's it. And relax. So here I'm just pushing this hand, trying to extend the knee, and this one trying to push the heel over. Again, when she's contracting, you're getting your client to push down this way rather than this way we were doing before, okay? For our supine hip flexor quad stretch, we're going to use a Thomas test variation. Okay, so with this one, I'm going to anchor the opposite hip, so we're not going to get twisting in the spine of the hip. And in this position, I'm going to go shin to shin and then push back into that quad hip flexor stretch there. What I'm going to do from here is I'm going to ask my client to push her shin into my shin. That's it. And then on the relax, I just bend my knee, which is going to push the femur down and the shin backwards, if allowed. Contract again, so she's going to push into me. Relax. The contract relax variation, after the contraction of the quad and hip flexor group, for the antagonist contractor, I ask my client to lift the heel to her hip and maintain the knee downwards direction. So just like that, they're going to hold that as hard as they can, 5 or 10 seconds. I meet back in that joint, ask them to relax and increase the range of motion if available. We're going to do a piriformis or glute variation of the PNF stretch. Very easy. We've just got to go very similar to a FAD test. We're going to go to hip flexion. Okay, and what I'm going to do here to get the piriformis is I'm going to drive this knee towards the opposite shoulder, like so. Okay. From here, I'm going to hold the opposite shoulder down if available, and then ask my client to push her knee into my hand in this direction. Okay. And relax. I just push the knee to the opposite shoulder if available. Contract. Relax. Remember, each one of the contractions and the relaxes are in 5 to 10 second intervals. For the CRC variation, okay, my client, I've got to ask them to contract and reach their own knee to the opposite shoulder. So I'm going to reach across. We're going to do a contraction after a static stretch, so push into me. And relax. 5 or 10 seconds passes. I'm going to ask my client to then reach her knee to the opposite shoulder. That's it, that's it. So she's trying to reach into internal rotation and then relax, and I meet her there. Contract again, so push it into my hand. Relax. Good, increase the range if available. Antagonist contract, so take your knee off my hand. That's it. Relax, meet them there, increase the range if available. You repeat that 4 to 5 times. So for our adductor PNF, we're going to do a short and long leg variation. So short ones, just like the test before, leg over, okay? In this position, I'm going to hold the opposite hip, so we're not getting any hip rotations, spine rotations. I push down here, and then for the contract relax, the CR variation, I ask my client to push her knee into my hand this direction. Contract. Relax, increase the range if available. 5 or 10 seconds. Contract. Relax. Don't push this foot into your leg. Don't push that into your leg.
I just popped my kneecap.
For the contract, relax, antagonist contract variation, I'm going to ask my client to lift the knee off my hand towards the floor. So push into my hand. Then relax after 5 to 10 seconds, increase the range if available. Then I ask my client to antagonist contract by lifting the knee off me, which really gets that glute med. Relax, give them range if they can available. Then again, after 10-second relaxation, push into me. Relax, increase the range if available. And then again, antagonist contract by lifting the knee away from my hand. Again, repeat that sequence 4 to 5 times. Our straight leg variation for the adductors, for a long adductor, is obviously just a split out like so. Again, I'm going to hold the opposite hip, so I'm not going to get any rotation. And a special note with this leg, I've got to maintain neutral. A lot of the time in the contract relaxes, what the client may do is use a compensation by externally rotating and trying to use the hip flexor to abduct away instead of using the TFL and glute to abduct away. So I just keep this slight, I'm pulling into internal rotation to make sure this femur stays neutral. And I want neutral extension. So I don't want to be up in hip flexion, that's what we did before. I want to be in a neutral position here. So what I ask them to do for the CR series is ask my client to push her leg into me, close it towards the opposite leg, relax. After 5 to 10 seconds, I increase the range if available. Don't let an external rotation happen on this leg. 5 or 10 seconds, relax. Ask my client to contract inwards again. And relax outwards. For the contract relax sequence, after the contraction of the target muscle, I'm going to ask my client to lift her leg away from my leg here. So lift away, antagonist, making sure it doesn't go into external rotation. Nice. I meet the leg there and relax. Target muscle contract, so contract inwards. Relax. Increase range if available.